it's important to realize that HIV and AIDS affects all of us. You may be infected and it affects you directly. You may know somebody that's infected and it does affect you, or somebody in your own family may have died of HIV and AIDS. And if I'm not infected, I still am affected because we live together in our community. That spirit of Ubuntu says, I must consider the fact that I could myself get infected. My son could get infected. In fact, as a parent, what really guided me as a Deputy Minister of Health in my approach to HIV and AIDS was the fact that I'm bringing up 2 young teenage sons, and to realize that my sons could be infected. So I felt I too could be infected. So I felt it was important that first I should lead by example. I must go and test for HIV and AIDS. I must encourage my sons to go and test. I must encourage people in my community to go and test, because in that way, in living by example, you actually make people see that this is something that we can overcome. HIV and AIDS can be overcome, just like other diseases that we have had. We have had TB. Of course, it's come back now with HIV and AIDS. There's cancer, which previously was considered a death sentence. But because we cooperated and worked together, the scientists working together with the health professionals and government, were able to find some ways in which to combat cancer. And I think with regards to HIV and AIDS, what we now struggle and work hard to do is to find a vaccine for HIV. And that is particularly important for governments to, as we look at how to distribute our resources, to consider that there's this issue that affects people very directly, but that is killing people. And it is absolutely critical for us to value life, to conserve life. Because as much as it is precious to me, it is precious to the next person. So it's really about caring for one another. And especially in a position where people have put their trust in you as a leader to take the responsibility for their lives.